Hello viewers, welcome to my YouTube channel and don't forget to subscribe to my YouTube. My name is Sister Dr. Juliet Wambui Macharia. I am a gynecologist and a fertility educator and medical management doctor based currently in Voi. I belong to the Sisters of St. Joseph of Mombasa. And today it's a continuation of what we were discussing the last session about infertility. Today we are going to talk more about factors that are associated with infertility. And one of the most common factor is hormonal imbalance. Abnormal hormones, this is a condition where most of women suffer from. And some of them have visited different clinics. Some of them have been seen by different doctors. Some have been managed well, some have not. But let us remember that this condition does not only occur suddenly. It has taken years and years to happen. And most of women may have gotten this problem when they are in their adolescent stage without them knowing. They had irregular cycles, they had long cycles, they had short cycles, but because it was not a big issue for them, they took it lightly. Now they are married, they want to conceive, and they are not able to conceive. So this is a long-term problem that women may have suffered without them knowing. And this is what we are telling you viewers, that anyone who has a young girl and who has such issues, heavy bleeding, abnormal regular menses, you find that they are regular this month, next month they are not regular. We talk of irregular menstrual cycle. Young girls who present with very painful menstruation. These are issues that need to be looked very early, so that this young girl is not just left to suffer from this until now when she comes, now she wants to conceive and she's struggling to conceive. But the problem happened long time ago, if only it could be managed. So abnormal hormone is a very big complaint that most people are facing now. And sometimes they don't know how to address it. They have taken a lot of herbals, well and good, it's part of the management. They have taken a lot of drugs, well and good. But is this problem solved? So, as we are talking now, we have a number of women who are normally very gloomy. A number of women who present to us with the issues of not able to sleep. When others are sound asleep, they are always awake. A number of women who present to us with issues of irregular menstrual cycles. We have women presenting what we call secondary amenorrhea. They have been having their menstruation, but now it stops. It will come back after 3 months or 6 months or even more than that. Some with what we call intermenstrual bleeding in between the menstrual cycle. But a good number of women are not ovulating. Remember my slogan, ovulation is a sign of health. So any woman who does not ovulate is not normal. So research has shown that these women, majority of them with abnormal hormones, and who will come to us seeking for help, majority of them are not ovulating. And they come to us saying that they have their menses are okay. They are bleeding. The bleeding days are between 3 to 7 days. They have at least one heavy bleeding or 2 in their cycle. It takes 4 days and it's dry up. But remember, menstrual bleeding is important, yes. The patterns are very important. But she may bleed normally, but she does not ovulate. So if we don't manage her properly, we may end up telling her that she's normal while she's not normal. So have you ever come across women with skin changes that tells you something that all is not okay. Last session, we talked about it, that these are women who, they have acne. The face is very rough. It has got either very big pimples or small pimples. That never goes away. They are always there. These are women who present with a very dry skin. Dry. They are not menopause, they're still young. But their skin is, despite of the creams they use, the skin is still dry. These are women who will present with what we call alopecia. Yeah, the hair just comes out. So they put on wig because they don't understand what is happening. The hair is just coming up. These are women who will have their breast milk coming out when they are not breastfeeding. When you look at them, they have what you call hirsutism. The hairs around the chest, below the umbilicus, and also in the around this part, and even at the lower limbs, that's around the legs. They look like men, but they are not men. These are women. Some have beard. You look at them, they have what we call acocodoms. They have some tags all over. The tags, the dark tags, yeah? They can be around the neck, they can be at the skin and at the cheeks, and even most of the time you find it around this place. And some of them will complain of unknown allergies. They always have allergy. They have been managed, they don't understand why all these allergies. They don't know even the cause. When you get women with light skin and you try to do whatever I'm doing here, they blush, yeah? Easy blushing. They turn red. When you look at their back, you may find some spots, so many spots. And even below the back, you may find some hairs around there. And these are women also, majority of them will seem to be obese. Yeah, they are obese. And they eat. They have very good appetite. They eat. So what are we saying? These are some of the signs that we need to pick as medical practitioners when these patients come to us. It is very, very important to pick this because it will tell you something. Any woman who has low estrogen levels, the appetite tends to be very high. So it is not their wish. It is the hormone that is normally the estrogen controls it. But because now the estrogen is low, it cannot control the hormone which makes somebody to have appetite. So that hormone is high. So they eat. They are innocent. They eat. So that is one. So when we have women with hormonal imbalance or abnormal hormones, and when it comes to women now, we have these very, very important hormones, which I've talked about them when we're looking at the science behind the menstrual cycle. And this is the estrogen hormone, the progesterone hormone, the luteinizing hormone, the follicle-stimulating hormone, and gonadotropin-releasing hormone. So there is an association between the brain and the hormones. When you talk of gonadotropin-releasing hormone, it is being released from hypothalamus. Hypothalamus is in the brain. The gonadotropin-releasing hormone will stimulate other hormones. And the first hormone to stimulate in the menstrual cycle, it is the follicle-stimulating hormone. The follicle-stimulating hormone now will be sent to the ovary. When it goes to the ovary, it stimulates the follicles. So when it starts stimulating the follicles and they start developing, they start releasing the estrogen hormone. So the estrogen hormone is very important. But without the gonadotropin-releasing hormone, the follicle-stimulating hormone, we do not have estrogen hormone. If there is any abnormality, anything affecting the gonadotropin-releasing hormone, anything affecting the follicle-stimulating hormone, then we have issues in the ovary. We will not have follicles. Or we may have the follicles, but they are not well managed, or they don't undergo the process they are supposed to undergo. So, low estrogen hormones we either have very high follicle-stimulating hormone, or we may have a problem at the hypothalamus, such that the gonadotropin-releasing hormone is not released. So, we have a very special gene in the brain at the hypothalamus level. I'm not going to talk on details about it. It is known as King's peptin gene, or in simple we call it KISS gene. The King's peptin gene is very important. Anything affecting the King's peptin gene will make it not to open up. It is like a very important a receptor, or a kind of a key. It is the one which opens for the gonadotropin to be released. So if it is impaired in one way or another, it will not allow the gonadotropin releasing hormone to be released. So, and what can affect the King's peptin gene? One of it is what we call insulin resistance. When your body is releasing a lot of insulin, and the body is not able to make it being absorbed in the blood the way it's supposed to be absorbed, such that it does not interfere with your body system. So, excessive insulin in your body, and this now mostly to those who might be suffering from diabetes type 2 or diabetes type 1, but in this case, the women who are obese, producing a lot, the pancreas is trying to produce enough insulin so that it can meet the challenges that the body has. So we are overworking the pancreas. The insulin is being released in large numbers. So excessive insulin impairs the King's peptin gene. And if the King's peptin gene is impaired, then the gonadotropin-releasing hormone will also be impaired. And the whole system, the follicle-stimulating hormone, the estrogen, and everything. Then that means that even your menstrual cycle is being affected. So this is very key to understand. We have women who might be informed that they have hormonal imbalance, but you just need to cut down your weight and things goes back to normal with a few medication. You just need to avoid taking in a lot of starch. You need to do some exercises. You need to understand how to discipline your body so that the estrogen hormone can now be released, and the other system, the gonadotropin-releasing hormone, the follicle-stimulating hormone, and now we have enough estrogen hormone, which during ovulation will reach at peak. When it is at peak, the progesterone hormone takes over, the estrogen hormone goes down, the progesterone a bit low, the progesterone hormone will keep you moving during the luteal phase. You will have enough of days during the luteal phase. So remember, we have some of women who have abnormal hormones, especially the progesterone hormone, such that when they ovulate, of which is not the real ovulation, they tend to have very short luteal phase. So one moment you have a short luteal phase, you will tend either to bleed a bit earlier than the normal. When your body releases follicle-stimulating hormone earlier, before the menstrual cycle begins, the follicle-stimulating hormone is still very high. These are women that will present with short cycles. So be very careful, my dear people. Unless we understand your hormones, and this is the problem that I face when managing these women, because I tell them these hormones are very important. I need to know these hormones. By examining her, I get to understand she may be suffering from this. So do these hormones for me, and then I'll know how to manage. Unfortunately, they don't. So if you don't follow what the doctor is trying to tell you, we may delay your management. So any woman who
who does not see the cervical mucus, cannot feel it. She doesn't know even how it looks like. Remember, it is egg white in color. It is not false smelling. It does not make you to itch around your vulva. It does not make you to feel uncomfortable. It is just natural. So cervical mucus has a very big role when it comes to infertility. Any woman who is fertile, producing cervical mucus, her hormones are okay. The cervical mucus plays a very important role in this woman. One, it helps to transpose the sperms all through from the posterior fornix of the vagina, through the uterus, through the cervix to the uterus, then to the fallopian tubes, and then it goes to meet the ova, which has just been released during ovulation, has just been released. So it helps in the transport of the sperms. That is one. Two, it stores and it nourishes the sperms. So the presence of the cervical mucus within the cervix helps the cervix to be able to store these sperms for a period of around 5 days, waiting for the ovulation to occur. So a woman who, let's say, will ovulate on day 12 or 13, and she have the cervical mucus on day 9, yeah, the presence of cervical mucus is there. What we call the estrogenic mucus. This is a clear mucus, stretchy in nature, yeah. So you are about to ovulate on day 12, and then you have your sexual intercourse on day 9 or on day 8. The presence of this mucus, the ovulation has not started, but you're in your fertile window, those fertile day, and you are able to see the mucus. Then the sperms will be stored and nourished. They will feed, the mucus is able to take care, making sure that they are healthy enough. And once the egg is released and the presence of the cervical mucus, the sperms are able to move forward, being directed to where the ova is, whether on the left side or on the right side. So that's the second role. The third role, it moisturizes your vagina. And as it moisturizes, it cleanses. Yeah, this is natural water cleansing the vagina and or even the cervix. So it cleanses. And for those who are able to see the cervical mucus, you will sometimes find it at, you can see it in the, at a lining at your panty. Sometimes you go for micturition and you are able to see it. So it's just natural. But also the fourth role, it is acts as a sieve, yeah. The sieve, the Swahili say kichujio. So not all men will release 100% normal sperms. So some may not have the tails, some may not have the heads, and some may present with abnormal structures. So these sperms are never allowed or are not allowed to go and meet the healthy ova. So the cervical mucus normally sieves these abnormal sperms, and then it releases the normal sperms. So this is a very important role, because we want a healthy sperm to meet a healthy ova so that they can produce a healthy fetus. So that's the role of the cervical mucus. But the last role, it is protective in nature. After the ovulation has taken place, the estrogenic mucus, this is a stretchy, clear mucus, which occurs just before and during ovulation, Once the ovulation has taken place, the estrogen will go down and the progesterone will go up. So the presence of enough estrogen will change the estrogenic mucus into gestagenic mucus. So the gestagenic mucus is normally thick. It closes the cervix. And the moment it closes the cervix, there is no intruder, no organism, not even the sperm will close the cervix. So it is protective in nature. So when you ovulate well, the presence of good estrogen help us to know that even the progesterone levels will be good. So these women with abnormal hormones tend to have one or two or even all of them of these important hormones in women being abnormal. So if a woman presents to you telling you that I'm always dry, I do not have any cervical mucus. Majority, when we check the estrogen, it is normally low. It is normally low. So, presence of low estrogen will help us to understand the follicle-stimulating hormone in these women are normally high. And these are women also who they will claim to have their menses. But according to fertility education and medical management, that is FEM, any woman who does not ovulate, even if she menstruates, the menstruation is not normal. That's why we talk of menstrual ovulatory cycle. There is bleeding, there is ovulation. The follicular phase, the luteal phase are within the normal ranges of days that we need in this lady, and hence she is ovulating, then she has a normal menstruation. But you cannot say you have a normal menstruation when you are not ovulating. So always remember, any woman who presents with abnormal hormones, she may present with high prolactin levels, high thyroid hormones profile, the abnormal, they may be high, it may be low, hyperthyroidism, hypothyroidism, it may be euthyroidism, but clinical thyroidism, and sometimes we tend to play around the recommended values using our fertility education and medical management, and we are able to see these things are not okay. We need to manage our patient. So always remember, signs and symptoms, the skin changes, and what the patient complains about, plus your examination, your investigation, and your management will make this patient or this woman before you return back her menstrual ovulatory cycle, and therefore she's able to conceive. Now, we have been talking about female. Now, let's talk about hormonal imbalance in men. As I had talked earlier, is that the number of men who present with infertility, the rate is increasing. So we should stop the myth that issues pertaining infertilities are for women. No, both couples need to be examined and investigated, and then we are able to manage you well. So, FEM will always manage the two of you, not one. Unless, because men do not like coming to the hospital, sometimes we have no option than managing the lady. But if you have a problem and you wish to come and see Sister Juliet, I encourage you to come, both of you. So, most of men, when they come to us, some have presented with the low testosterone hormone, some may present with abnormal prolactin hormone, follicle stimulating hormone, and other hormones that we normally manage. And these are men who, even during the sexual intercourse, this man cannot perform well. He performs today, he will perform tomorrow, or after 3 days, or even after a week. He gets tired, he has no libido. He may present with the ejaculation dysfunction. He's not able to ejaculate. So this is a problem that men feel inferior about it. They don't want to talk about it because it stigmatizes them. And sometimes women may even play a role because they may use that as a weapon, that you are not a man. No, he's sick, just as you may also be sick. So just help him, encourage him. Be the one to bring him to the hospital so that we can manage this problem. So most of men who are obese, sometimes we think it's a sign of richness, it's a sign that you are healthy, it's a sign that you have a lot of money, it's a sign, okay, you are at peace with yourself. Well and good. But there is an association between obesity and the low levels of testosterone. So mine today is to encourage you. Most of the issues that we have can be managed by lifestyle changing. Before you come to the doctors, look at yourself. See what could be the problem. Or the moment you note that you have some issues with your menstrual cycle, don't just sit and wait. Visit any gynecologist around you. She will instruct you well, or he will tell you what to do. If you wish to come and be served by fertility education and medical management doctors, you can contact us. So, as I end my session today, I'm saying that hormonal imbalance can be managed. But the most important thing is to understand the underlying cause. We have what we call a polycystic ovarian syndrome in women. Find that women have got, they have been told that their ovaries are filled with fluid and they have small follicles at the periphery of the ovary. So this is the ovary, and then we have the follicles arranging themselves around here. So many of them, small in size. And then in between there is water. In Swahili, we call them mayai maji. So this is a problem, and majority of women has got this issue. And there is a myth that if you have PCOS, you cannot conceive. I want to say no to this myth. Because the moment we know what type of PCOS you are suffering from, and this needs you as a patient to cooperate with the doctor, so that when she asks you or when he asks you, do this and this and this, you are able to do it. Do this hormone at this specific day of your menstrual cycle. Buy this medication. PCOS is managed. But we have to understand what type of PCOS. So, among the 4 types of PCOS, there is one which is very common, whereby ladies will present like the way I've just said. They are normally obese. Yeah? The BMI is high. They are either in class 2 or class 3 of obesity. And these are women who will present with a shiny face. They sometimes present with the acne, we have said, with the beard, with hairs, even below the umbilicus. Even if they are tiny, they are not supposed to be there. Even if we have 1, 2, 3 beard, you are not supposed to be there. These are women who we sometimes, majority of them don't ovulate. They don't see the cervical mucus. So there is hope in this. It is the year of hope. We are giving hope to these women who have lost hope, to these couples who have lost hope because they are not able to conceive. There is hope, and the FEM has shown that hope, have brought this hope to many. So do not shy up. Please contact us. And for those who live within Mombasa, Kilifi, they may visit the Mother Amadea Hospital in Mikindani, and you may even call that number which is at the screen, Mikindani Hospital, Mother Amadea Mikindani. It is owned by Sisters of St. Joseph of Mombasa, and you may call and they will book you, so that when the number is the number gets big, if we have 3, 4, 5 patients, I can come over and see you. Those who are in Voi, you can contact St. Joseph Shelter of Hope Clinic here in town. The number is just running there, down there at the screen. And you can call them and they are going to book you and they will inform me. Those who are comfortable also at attending the Savo Hospital, again in Voi, you can contact the Savo Hospital. The number, you can see it down there, and they will let me know about you. And we are able to treat you. There are some in Nairobi. Nairobi, I'm not yet to come, but we have Dr. Wachira, who is also a FEM doctor, and you can also visit him. I'll get his contact, and next session I'll also be giving that contact below there. And we also have women in Nairobi can also contact Patricia Ogwambo. The name is there, and so many other FEM doctors. But if you feel free, you can call me. That is my number there, and we can see how to help you. We also will continue also giving more sessions about infertility. This is the only one factor we have talked about, and we are also going to learn more. We have infection, how it affects infertility. We also have structural issues. That one we'll be talking in the next session. Please and please, I know you have viewed me and you are happy with the information that you are getting. Don't forget to subscribe. When you subscribe, you promote me in one way or another. So I really appreciate, and please continue tuning in my video. You can also continue viewing the previous videos and you learn more, because as you note, it is actually it's a flow. Yeah, it's a flow. So get to understand the first, the second, the third, and subscribe and continue following us. And if you have issues, please don't hesitate. I have good news, especially to people in Taita Taveta County. I also work in Moi. You can visit a gynecological clinic in Moi every Wednesday. But for women with obstetric complications, those with diabetes, those who are obese, those who have previous scars, those who have recurrent pregnancy losses, those who are trying to conceive and they are not able, I will be having fertility education and medical management clinic at St. Joseph Shelter of Hope Hospital every Friday of the first Friday of the month and the second last Friday of the month. So those 2 days of the month, I'll be offering this clinic for all those who need. You can call St. Joseph Shelter of Hope Voi, and we are able to book you. And once you have the appointment, then we can meet and talk more. So as I say bye to you, I wish you well, and I pray that God will always keep and bless you. And those who are sick among us, you'll get healed. And please don't forget to subscribe. Thank you, and bye-bye.